Okay, now this particular training is entitled Aerosol Transmissible Diseases. This is the exposure control plan training for a dental facility. So now as a dental facility, it's very simple because you are now considered a conditionally exempt facility, and we're going to talk about that in just a second when we talk about the different classifications. But again, as an introduction, I'd like to just share with you a little bit of a history about aerosol transmissible diseases standard and how it came about, and then we define the disease as well as tell you what the requirements are for a dental facility. So aerosol transmissible diseases started out originally in 1991 as the TB standard, or TB being tuberculosis, and this particular standard never made it into a regulatory standard. It became more of a guideline because it was very difficult to test everyone for TB, and so Cal OSHA decided to just make it a guideline. And then in late 2009, because of all the different diseases that were discovered, such as H1N1, SARS, and different types of flu-type diseases, they decided to make this a standard, and they entitled it Aerosol Transmissible Diseases. And this standard now is required for anyone operating in California. And right now it's just California, but soon I'm sure it's going to go into different states of the union, but right now it's just a requirement for California employers. So as a dental facility, first of all, you need to know that aerosol transmissible diseases are diseases or microorganisms that are transmissible through the air, and they come in two different forms. Some are called droplets, transmissible by droplet, and the other one is called transmissible by airborne solids, or air IDs. And if you're looking at your notes, you'll notice that there are two charts there, two tables. Table 1 are examples of diseases for droplet, transmissible by droplet, and the second table is transmissible by airborne solids. Now, the ones that are airborne solids require more precautions, and you need to make sure that you definitely refer that patient to the emergency room because in a hospital, because they are most equipped to handle those types of diseases. So the first thing you want to know is, what are these different classifications? Well, if you're looking at the classifications, the first type of facility is called treating facility. A dental office is certainly not a treating facility. So if I had a cough for a long time, or if I was coughing up blood, I'm not going to go see my dentist to see what's wrong with me. So I'm going to go to a hospital emergency room, or go maybe see an infectious specialist, infectious disease specialist, or maybe a internal medicine or pulmonary specialist, and so on and so forth. The second classification is a referring facility, and certainly a dental office will not be classified as a referring facility because, again, if I had symptoms as a patient, I'm not going to go see my dentist to see what's wrong with me. So that would be more of a primary physician or a general practitioner that you would go to see if something's wrong with you. Now, of course, the third classification, being conditionally exempt facility, that's the classification that falls for, that is considered to be a dental office. Now, dental office, meaning that a dental facility is considered a conditionally exempt facility. And this means that you are exempt from the most of the standard, except when you encounter a patient that displays flu-like symptoms that is coming for a dental procedure. Now, if they have a high fever, if they're coughing, especially if they're coughing up blood, and certainly any other symptoms such as chills, achy body, night sweats, sudden loss of weight unexplained more than 5 pounds. These are clear signs of a serious disease such as aerosol transmissible diseases, and you need to immediately refer that patient to their primary physician, or if the symptoms are really bad, directly to a hospital emergency room, and certainly don't want to be working on them as a dental patient. And certainly, if it's a seasonal flu type of a thing, you might still want to work on a patient. That's completely up to the dentist. And the goal, again, is, or the requirement is, that the employer, being the dentist, must do everything in his or her power to protect their employees from contracting any of these types of diseases. So we also have two other categories. One is a medical laboratory, which certainly you're not one, and certainly a zoonotic facility. This is a facility that deals with animals, such as a vet hospital, animal hospital, or an animal shelter of sorts like that. So what is required for you as a dental facility? You still have to have your written plans. You still have to have certain things in the facility, which we're going to go over in a minute. But what is the best thing for you to do? The only option that you have is you screen the patient. If you feel that it's safe to treat them, then you treat them. If you don't think they're safe to be treated, or you may have doubts about what they might have and how contagious it might be, you are going to refer them to their primary physician or certainly a hospital emergency room, depending on the severity of the symptoms. And that's the only option that you have. As a medical facility, you have other options. You may treat certain diseases, may not treat certain diseases, but those are not options for you as a dental facility. Now, what do you have to have? Well, I've already talked about written plans, which we've provided for you. Written plans means that you have to have a written chapter, which we have in our safety manual, that shows that you are following these types of requirements. And these written plans have been provided to you in your safety manual, and that's all you need to have there as far as the requirement is concerned. Also, in your waiting area, you do need to have some surgical masks available for patients who might be coughing or displaying flu-like symptoms, so that you ask them to put on the mask before they enter your facility, and then you can screen them in the privacy of an operatory or a consultation room, and then decide whether you're going to treat them or not. And certainly confer with your dentist on all of these matters before you do anything. And then, of course, the employee has to have a mask on, and you want to keep a good distance from 3 to 4 feet away from the patient, and that way you are in a safe distance. And of course, if also you notice in your waiting area, a patient is with someone, a companion, maybe their husband or wife, and the husband or the wife who's the companion is the one who's coughing or displaying flu-like symptoms, you can ask them either to wear a mask if they want to wait in the waiting area, or if they don't want to put on a mask while they're sitting in a waiting area, you might want to ask them to step outside and wait for the patient to be done. And you can let them know that you'll notify them when the patient is done with their treatment. And those are the two options. Also, a hand sanitizer is recommended, maybe a box of Kleenex and a small wastebasket in the waiting area. And again, I recommend small wastebasket because if it's a large wastebasket in the waiting area, then patients tend to use that for their lunch and whatever else they've brought in with them, and it's going to fill up very quickly. But if it's a small trash can, they tend to use it only for masks and maybe tissue that they use to blow their nose or whatever. So those are the kind of things that you want to have on hand. And that's pretty much it as far as your requirements for aerosol transmissible diseases. You do have to have training, and that is exactly what we're doing right now. So that's another requirement. And then the last thing you need to have is a cover your cough sign in your waiting area. And again, if you're in a predominantly English-speaking demographics, then just English is all you need. But if you're in an area where you have a strong ethnic community that might be Spanish or Chinese or Vietnamese, then you have to also have a sign in that language, whatever that happens to be the language of the majority of the people who come to your facility. So if you have all of those things in place, then you are compliant with this particular standard. And this actually concludes our training for aerosol transmissible diseases for a dental facility. Thank you so much for listening.